Hello, my name is Dr. Rajiv Shivshankar. I am an interventional neuroradiologist at INHS Ashwini, Mumbai. On behalf of the Society of Therapeutic Neurointerventions, today I will be speaking to you about a condition called cerebral dural arteriovenous fistula, or DAVFs for short. Cerebral dural AVFs occur when there are abnormal connections between a single or multiple arteries which run on the surface of the brain and veins which run either on the surface of the brain or venous spaces which run within its coverings. When this condition does occur, it causes a pushing of arterialized blood into these veins directly. This in turn increases or hikes up the pressure within the brain's veins or venous system. This abnormal high pressure that the brain experiences can lead to a condition where at some point in time it can cause an intracerebral hemorrhage. This animation shows how presence of a clot in a venous sinus can precipitate the formation of a dural AVF between the arteries and the venous sinus. To diagnose this condition, you may have to undergo imaging modalities such as CT scans, MRIs, and angiography. An angiography is a test where the doctor uses a catheter which is threaded from an artery, typically in the groin, up to the vessels of the head and the neck. There, he injects a special dye which is used to perform the angiography test. Once this test is done, it gives the doctor an exact understanding of the anatomy and angiomorphology of this condition. The other symptoms that patients may experience due to this condition include headaches, a ringing noise in the ears which is called tinnitus, a feeling of heaviness in the head, and in some cases, if the pressure gets transmitted along the spinal cord, which is nothing but an extension from the brain, it can cause weakness of the upper or lower limbs as well. In severe cases, patients can have disorientation, drowsiness, and seizures as well. Cerebral dural AVFs are treated by a procedure called endovascular embolization. In this procedure, using fluoroscopic guidance, the doctor threads a fine catheter called a microcatheter into the arteries which supply this fistula. Once he reaches the correct position, he injects a special liquid substance which percolates along the various channels of communications between the arteries and veins which constitute the fistula. Once the liquid plugs all these channels, there is an exclusion of the fistula from the circulation, thereby restoring the brain's former pressure gradients to normal. This animation shows how endovascular embolization is performed by threading a fine microcatheter within the arteries which supply the fistula, and after reaching the fistula in an appropriate position, a liquid is injected, thereby excluding the fistula. Microsurgical resection or radiosurgery may be offered to patients whose fistulae cannot be closed due to technical reasons by endovascular embolization.